Hello, my fellow students. How are you? How can you hear me? Okay, I see you put your name. That's very good. It's a new tradition to put your name in the beginning of our lecture. And okay, today I'm going to talk about large joints in our body, and let's get started. This is okay. So our topic. And human skeleton, of course, needs to move, and all our bones connected in the body, in the joints, and it gives us opportunity to move. And first of all, I'd like to talk today about vertebral joints, or about vertebral column. Then I hope we have time to discuss a little bit the thorax or ribs and thorax cage bones, and then we will discuss upper limb and then lower limb joints. Now let's start. First section of today's lecture is vertebral column. The vertebral column, also called the spine or backbone or spinal column, it is synonyms, and it makes up about 2/5 of the total height of the body. It is about 40% of the height of the body is because of the height of the vertebral column. It is composed of a series of bones, and they are called vertebra. The vertebral column consists of bone and connective tissue. It is not only vertebra, it is also some connective ligaments, membranes, etc. And tissue of the spinal cord, because inside of vertebral column, spinal cord is located. The length of the column is about 71 centimeter in average. It is about 28 inches. And in average, adult male vertebral column is about 61 centimeters. And in average, 71 centimeters is male vertebral column, and 61 centimeters female vertebral column. Spinal column function as a strong and flexible rod with elements that can move forward, backwards, sideways, and can also rotate. It's enclosed and protects spinal cord, as I said before, support the head, and serves as a point of attachment for the ribs, pelvic girdle, and muscles of the back and upper limbs. So that's a total elements in our body, which is central, like a center part, and it is the structure which other structure attached with. The total number of vertebra during early developments is 33, but then several vertebrae in the sacral and coccygeal regions fuse. They fuse together. As a result, the adult vertebral column typically contains 26 vertebrae. What kind of? Here is 7 cervical vertebra in the neck region, 12 thoracic vertebra, 5 here, 7 cervical, 12 thoracic, 5 1, 2, 3, 4, 5 lumbar vertebra, 1 sacrum. It consists of 5 fused vertebra. 1, 2, 3, 4, 5. 5 sacral vertebra are fused together. And os coccygeus or coccyx, it is made from 4 or sometimes 3, sometimes 4, sometimes 5 coccygeal vertebra. So, but if we see, it is about 26 part of the total vertebral column. What kind of joints we could find in the spinal column? When we are talking about unfused or separated vertebra, we would see the connection between body of vertebra or corpus vertebra. This is a 2 corpus of vertebra, and between them is intervertebral disc. Intervertebral disc. He is also visible. You can see this is the discus intervertebralis in Latin, and it consists of 2 parts. Inside of disc is nucleus pulposus, and out of nucleus are annulus fibrosus here. Nucleus pulposus is a little bit like liquid. It is like a gel, but annulus fibrosus is made from fibrous connective tissue. It is very, very strong, and it helps to resist of the pressure by when we walk, and when we jump. It helps to reduce of stress. Then we see 2 big ligaments on the vertebral column. On the front side is a longitudinal or anterior longitudinal ligament, and on the back of body. It is the posterior longitudinal ligaments. So two ligaments, anterior and posterior. Then there are yellow ligaments or ligamenta flava between arcus of vertebra. Here is arcus, here is one and second, and between is located ligamentum flava. It is yellow, flavum in Latin means yellow, and it is really yellow because there is a lot of elastic connective tissue, and elastic fibers are usually yellow in comparison with the fibrosis fibers. So that is the main joints of unfused vertebra, and they help to keep all unfused vertebra together, and also to give a possibility to move. One interesting episode of clinic. This is the herniated disc. What does it mean? With age and repetitive stress, the annulus fibrosis can rupture. Here is ruptured annulus fibrosis, and it causes to nucleus pulposus to ooze. It come out of centrum of the disc, and it can ooze out of in the back direction, or sometimes in the lateral direction, or sometimes in anterior direction, but more awfully it go back, and it is located. This is a hernia. We call it hernia. It is located in intervertebral foramen. This condition is called, as I said, herniatic disc, or Schmorl hernia. This is a personal name, Schmorl. Schmorl is the author who was first to describe this pathological situation. And within the vertebral canal, the protruding nucleus pulposus can compress spinal nerves, and it is not picnic. Let me tell you, the compression can cause severe pain and to radiate along the course of the involved nerve. All human can have such a problem. About 50% of all people around the world have such a problem, like a herniatic disc. Usually, herniatic disc occur most often in areas of the vertebral column subject to the greatest stress and where the greatest spinal motion take place. Between 5 and 6 cervical vertebrae, and between 4th and 5th lumbar, or from and between fifth and lumbar vertebra and between sacrum. So it is a typical place where herniatic disc is usually located. Spinal column of adult is divided into 4 regions, as I said, and presents 4 characteristic curvatures in the sagittal plane, like here. This is the curves of spinal cord, and there are 4 big physiological curves. Here is first one is cervical, then thoracis, then lumbar and sacral. But if you see the curve in cervical part and lumbar part, it is the curve on the back. It's turned back here and here. But in thoracic region, in sacrum, it's turned right, turned forward. We call back curve as lordosis, cervical lordosis and lumbar lordosis. And also there are thoraces, kyphosis, we call such as curve and turn forward, we call thoracis kyphosis, and in sacrum region is also thoracis kyphosis. So why such curves located here? What is the function of these curves? They are the result of human adaptation to upright bipedal locomotion, and these curves act as a spring to cushion axial loads. When we walk, when we jump, and when we move with whole body moving, such as the curves helps to they work like a spring. Spring, it is not the period of year. It is the metallic construction. Usually helps to cushion in when we have axial loads. Okay, this is a normal curves, and you see the formation of curves during childhood. In 3 or 4 months, baby has only one small curves in thoracis region. Then when baby starts to sit, usually cervical curves appears. In 11 or 12 months, lumbar curves also appears when baby start to stand or walking. So that's a typical periods for formation of curves in human. I'd like to say a couple of words about incorrect or wrong posture. Incorrect posture, like you see here, incorrect posture, and right posture. When we have incorrect posture, it causes some problems. And signs of wrong posture is head is extended beyond longitudinal axis of the body. It means that head is forward. It is curved a little bit forward. Shoulders are brought forward also. Forward. And they are little bit raised tensely. Our back is round during the wrong posture, the round back, and the chest is sunken. Belly is also stick out like here. You can compare that here and here belly is stuck out, and the pelvis is slightly set back like here. This is a typical wrong posture, but that is some kind of abnormality, but not pathology. I'd like to show you abnormal curves and sometimes pathological vertebral columns. Here we see some abnormal scoliosis. We call it like scoliosis. It means a curve not in sagittal place but in frontal plate, in frontal plates. Usually people have S-shaped scoliosis. Typical is curved to lateral, to left lateral position. Kyphosis like in thoracic region is also pathological because it is extra kyphosis. And we also can see extra lordosis in lumbar region. Why is incorrect posture is bad? First of all, it is bad because people have frequent headache and spine vertebral aches, some kind of dislikes in not only in vertebral column but also in head. Second reason why incorrect posture is bad, that is all internal organs are compressed and they don't function well. Compressing of internal organ is not good. And also when people have incorrect posture, usually they lose height in 1 or 3 centimeters. It means that the total height is lower than for normal posture. What kind of movements we have in vertebral column? That is some typical lateral flexion. Here we curve or move our head right and left. Then it's possible to flex and extends head forward and back. We call it flexion and extension. Flexio or so extensio in Latin. And we also have rotation around vertical axis, and we call this range of motion, we call it torsio in Latin. Total vertebral column also moves in the same direction. Lateral flexion, forward and back flexion and extension, and torsio. Okay. A couple of words about atypical vertebra joints. That is first and second vertebra. They are not typical. They not like other. And first we call atlant. This is the first cervical vertebra. And second we name as axis. They have three joints between there are three joints between the first and the second cervical vertebra. I hope you remember this name, and we discuss these joints last lecture, but let's repeat it again. The central joint is pivot. It is like a cylindrical. It has a cylindrical shape, and it is only one. But two lateral atlantoaxial joints, here is lateral atlantoaxial joints, here is lateral atlantoaxial joints, and here is median atlantoaxial joints. That is cylindrical, but those one are plane joints. They are plane, flat. And those three joints between first and second cervical vertebra are combinated joints. What does it mean? It means that movement in median atlantoaxial joints is not possible without movement in lateral atlantoaxial joints. And the resulting moving is rotation around vertical axis when we turn our head left or turn our head right. And one of important ligaments protect and make this combination of joints strong. That is the crucial ligament of Atlantis. This is a real cruciate ligament. It is like a crest, and it keeps the dense of second vertebra. Here is visible. This is the dense axis, and it is attached in close to the arcus anterior of Atlantis. This is very important ligament of vertebral column. Take it in consideration. Next is thorax joints. Thorax joints usually consist of several thoracic skeleton or thoracic cage or thorax. It is very short name, thorax. Consists of vertebral column, 12 pairs of ribs and sternum. Here is vertebral column. Here are 12 pairs of ribs. Those are ribs, left and right ribs, only 12 pairs. And in centrum of thorax is sternum. That is a flat bone, typical flat bone. This structure, I mean all thorax cage or all thoracic cage or thoracic skeleton are movably and those joints of thoracic skeleton, all of joints are movable, and all of bones are interconnected by ligaments. They have also true joints, like between ribs and vertebra, and have also synchondrosis cartilaginal joints. Here it's visible in the front wall of thoraces. Also, when all bones combine together and when they look like total, like a big construction of bones called thorax, we can see two big aperture. First one is small and called superior thoracic aperture here between first thoracic vertebra, first ribs and manubrium sterni, but below there is inferior thoracic aperture here. It's a big one, and typically normal thoracic skeleton or normal thoracic cage is like conical. It has conical shape, like a cone. And what kind of ribs we can see in thoracic cage? I hope you remember that by lateral view we can see 1, 2, 3, 4, 5, 6. Sorry, 1, 2, 3, 4, 5, 6, 7 true ribs. They attach to the vertebral column below and to the sternum in front of or in front side of thoraces. Then bluer, 1, 2, 3 ribs. We call it false because they have only adjustment to or have connection with thoracic vertebra, but they are attached to the upper part of ribs. And 2 ribs we call free ribs, or in Latin we call it costa fluctuantes, fluctuatio. It means they move and have no connection with sternum, no connection. So 3 group of ribs: true ribs, false ribs, and free ribs, or fluctuantes ribs. The picture here is visible. We can see synchondrosis between first 6 and 7th ribs. This is no joints, only synchondrosis. But 2nd, 3rd, 4th, and 5th ribs have truer joints. You can see joint space between chondros or cartilaginous part of ribs and between sternum. Here is the gap. Okay. And next picture, I'd like to show you synovial joints between ribs and between thoracic vertebra. There are 2 joints, and first one we call joint of head of ribs, or articulatio capitis costa in Latin. Let me remember you that you have also to teach not only English words, you also have to study all Latin terms we have in anatomy, in human anatomy. I'd like to, I see all of you, only how many people? 17, okay. Do you hear me clearly? My friends, don't be silent. Tell me something. Write me something. Yes, okay. Thank you. Good. Thank you. Let's go forward. So, and those joints are different. The shape of costotransverse joints between processus transverse and ribs is cylindrical or pivot joints, but here is usually like a saddle shape, and those 2 joints we call combined joints, because no possible to move these joints without these joints. Usually moving of these joints we have when we breathe slowly, inspiration and expiration, and ribs move up and down. The thorax cage becomes wide, and then came back, and we we expirate air out. And I'd like to show you different shapes, normal chest or normal thoracic cage. Typically, mostly people have conical shape of thoracic cage, and the angle, we call it substernal angle between the ribs and between cartilaginous parts of ribs, is about 90 grad, 90 grad is it is like direct, we call it direct angle. But when the angle is more than 90 grad, this we have hyperstenic thoracic cage. It's usually big and cylindrical. It has cylindrical shape. Another situation, when the angle is less than 90 grad, it is about we call it asthenic shape or asthenic thoracic cage. It usually it's typical for people who has height, long extremities, narrow body, and usually they have small and flat thoracic cage. I'd also can demonstrate pathological chest shapes. This is a ricket. Ricket is a disease when we have not enough vitamin D in the food. It can be ricket storage. It's visible deformation of ribs, especially in the cartilaginous parts of ribs. And also sometimes we observe, we can find funnel chest. It is some funnel chest is this is visible. Anterior wall of the chest is concave inside, like here. And some abnormalities about thoracic cage. Very often should be congenital cleft sternum. When we have split in between sternum, between two parts of thoracic cage, it may be very big or total splitting, like here. Sometimes it is a small splitting, like here. But if you see such a big split, don't think about fracture. This is not disorders. That is not trauma. That is the congenital abnormalities. Next, we come to upper limb and start from classification. All types of bones, joints present. A lot of types of joints are present on the upper limb and on lower limb extremities. Classification very simple. All upper limb joints can be divided to upper limb girdle joints and joints of free part of upper limb. So here is bones of upper limb girdle, we call it clavicular and scapula. We also call it shoulder girdle or pectoral girdle. Then three part of free upper limb. This is the arm, forearm and hand. Forearm is between arm and hand. In hand we have carpal bones or carpals, metacarpal bones or metacarpium in Latin, and phalanx or digitus or finger. And we start from the pelvic pectoral girdle, and we can see that joints of pectoral girdle and pelvic girdle are homologous. What does it mean? Homologous organs mean they are similar in origin and structure, but they perform different functions. The pectoral girdle, as you know, is composed of four bones, two scapula and two claviculars. They are connected to the body only in front, only in one place, and this place is sternum. The girdle of pectoral girdle or girdle of upper limb is not closed behind. It's visible. Scapula is not attached to the trunk bones, but pelvic girdle consists of two hip bones, and they attached behind to the sacrum here, and in front they are attached to each other, and the pelvic girdle is closed and forms an osteoarticular ring. Here is a pelvic ring. We called it pelvis. I hope you understand it. So the difference is between homological parts of limbs is visible. Upper limb girdle is open, but lower limb girdle or pelvic girdle is closed and looks like a ring. Okay. What kind of joints we could see on pectoral girdles? That is, there are three combination of joints. First one here, named acromioclavicular joint. Acromioclavicular joint between clavicular and acromion, that is the processus of scapula, quite big processus. Second one, and very important joint, is sternoclavicular joint. It is between clavicula and sternum. And the third one is scapula and thorax connection. That is not joint, that is not articulation. That is the intermuscular connection, and we call it synsarcosis. That is not true joint, that is not a real joint. That is the intermuscular connection, between muscles. So, what is the special feature of human joints, meaning pectoral girth? This is first one is the joints of pectoral girth form a half ring, as I told before, and it is opened back. Sternoclavicular joints here, sternoclavicular joints are very mobile, and we can move our shoulders up and down, front and back, because of these very mobile joints. Look at the picture when we see scapula, dog's scapula, and we can compare the human scapula. Human scapula is oriented vertically, but dog's scapula oriented mostly horizontally. So typically for human pectoral girths, this is the scapula. Excuse me. My friends, can you hear me? Okay, thank you. We have cut off in electricity, so let's restart our connection and go on. The fourth feature I'd like to discuss, it is the clavicular serves like a structure to move our shoulder to the lateral side, and it gives big freedom of movement for our upper limb. Okay. This connection between acromion and scapula we call acromioclavicular joints. It is plain joints and have quite little movements. It is not very mobile, absolutely not mobile joints. Inside of these joints we could find triangular articular disc, and it helps to add and it helps to more congruatively shapes of both joints. Quite big and strong ligament we could find between clavicular and coracoid process. Here is two big ligament, trapezoid ligament, lateral position, and conoid ligament, medial position, and together they are named coracoclavicular ligament or ligamentum ligamenta coracoclavicularis in Latin. Usually those ligaments are very, very strong, and because of these ligaments we have often special dislocation of the acromioclavicular joint and injury to the coracoclavicular ligament. When we fall down on an outstretched upper limb, maybe also rupture of acromioclavicular ligaments. Here is a sprain capsula of joints, not ligaments. Sometimes a little bit sprain of, but here is rupture, a break. It is a break of ligaments, and heavy, quite unhappy situation when we have dislocation of the acromioclavicular joints and total rupture of the ligaments. Another joints of pectoral girth called sternoclavicular joints between clavicular and sternum. Typically these joints has a saddle shape. Sometimes mostly it is saddle, but sometimes in 5% it is only spherical. There is a disc inside this joint, therefore this joint we called complex joint. The disc and articular surfaces are made of fibrous cartilage. It is not typical. Usually all discs are made from hyaline cartilage, but here it is fibrosis. What does it mean? It means thin, and the joint becomes spherical. Sternoclavicular joints has a powerful ligaments apparatus. This is a lot of ligaments around these joints. Interclavicular ligament, costoclavicular ligament, anterior and posterior sternoclavicular ligaments. So this part of clavicular is fixed to sternum very well, very strong, and when we fall down on the arm, usually people have fracture of clavicula, like here. This is X-ray imagination. Here you see typical clavicular fracture, and it is very common by falling, then dislocation in sternoclavicular joint. And the third type of pectoral girth joints is joints between scapula and the thorax. Here plastinated specimens, I did it personally in our laboratory of plastination in our department, and that is visible that between scapula and thorax have muscles, two muscles, thorax muscles and scapular muscles. Between them is a gap, and this gap we call synsarcosis. what that is not joint, that is intermuscular intermuscular connection, and it helps to move freely when we move our upper limb, and it helps for freely moving of our upper limbs. Next group is joints of free upper limbs. First one is very famous glenohumeral or shoulder joint, in Latin articulatio humeri. It is quite big and very freely move. It is most flexible of all joints in our body, but unfortunately it is the most dislocated joints in our body. 50% of all dislocations is in shoulder joints. We have 50% all dislocation in these joints. This joint has elastic capsula, here is visible, and only one ligament reinforce this capsula, and we can see three protrusion of the synovial membrane. Here first one is synovial vagina for a long head of the beats, and third one is additional elements in this joints is labrum glenoidale on the surface of scapula. Here is X-ray picture or X-ray image. All bones, humerus and scapula and acromion, and this one is coracoid process, scapula, and is also visible acromioclavicular joints. And you see a big gap between scapula and humation of the shoulder joint down, and no connection, it is not touched to the cavitas glenoidalis, to the scapula. I'd like to see how it is a process of surgical treatment or helps for dislocation in that joints. See, please. Move it. Surgery. Move. Lateral. Oops. And now is normal. This is amazing video, isn't it? Okay. Then connection between upper limb, that is articulatio cubiti. It's only Russian version, but this is articulatio cubiti or elbow joints, we call. Typically, this is three joints together, and we call these joints complex joints. I don't know why we have only Russian version. Maybe it is after cutting in electricity. Well, okay. This is the situation in elbow joint when adults when they make such movement in children, and it takes to them dislocation in one of the elbow joints between humerus and between radius, and the ligaments here is very famous ligaments. We call it annular ligaments of radius, or in Latin ligamentum annulare radii, and when we pull down or pull outside the forearm, it's usually may be a dislocation in this joint, like here. The joint between radius and ulna is two joints. First one is inside of elbow joints, but second or distal joints, joints are combinated joints, and only one moving is combinated moving is possible. We call it pronation and supination. Pronation when, like here, in the standard anatomical position, it's pronated forearm, but when we rotate forearm medial, and the first finger is in medial position, so like here, that is we call it supination and pronation here. Between radius and ulna we have a membrana interosseous membrane. Usually it's attached to two of these bones together, and no possibility to move to make abductio and abduction and adduction. So, but in first wall, the surgeon Krukenberg makes such as operation we call it claw, Krukenberg claw, which helps implement the possibility of adduction and adduction of the radius in the proximal humeroradial joints. Joints of wrist joints. Here is visible wrist joints. Typical this elliptical joints, and five types of movements: flexio, extensio, abduction and adduction, and circumduction. You can see also media, some carpal joints here, especially on these plates. Mid-carpal joints, blue, and intercarpal joints, green. There are a lot of eight carpal bones, and between them is mid-carpal joints. It's like it is it's herald shape joints, but other joints between carpal bones are plain or flat. Also, it is visible these joints on plastinated specimens. Here is mid-carpal joints, but here there are intercarpal joints. So I'd like also to show you connection between carpal bones, and this one is retinaculum. This is transverse carpal ligament, which makes all bones, keeps all carpal joints together, and it show moment mal here. This is a carpal tunnel under this retinaculum. In carpal tunnel located tendons of digital muscles, and vessels and nerves come here. They pass under tunnel. A very important joint between os trapezium and first metacarpal joints. We called it carpometacarpal joints of the thumb. Thumb is the name of the first digitus. This is the saddle joints, and it makes possible to move very freely moving of first digitus, and it comes to the other digitus, and we call it this movement oppositio and repositio. It is possible only in human manus, not possible for monkey or primates. And I'd like to say that the losing of movements in this hand is disability up to 70%. Okay, the other let me give you my presentation because of some unhappy cutting electricity slides in PDF presentation, what you can find in Moodle. Right now I put my today presentation in English. All slides in English will be possible to load in Moodle. So to refresh in your memory that you have come back to Moodle and find test. This test will be opened in 1 hour, and make it test after this lecture. Okay, so thank you for this is all for today, and if you have question, please send it me back to our forum. You can find in Moodle. I wish you good health, good luck, and hope to see maybe next week. Actually, I will have one business trip, so maybe we will have our lecture in recorded way. You can just to load presentation, and this is video about next lecture. So let's see. Thank you very much, and have a nice day, my dear friends.